my favorite type of person, the head of the family, the head of making your own decisions. You've got wonderful children, and you're trying to figure out what to do with the rest of my life. That's kind of what I'm hearing from you. And what do I do? And I think that having the hospice folks in the room and Dr. Frank, who's your family doctor, is really important, because it's hard to know what will happen. But best case scenario is that over time your breathing gets a little better. But unfortunately, with all that stuff that's going on in your lung, if something else happens, like you aspirate again, or you get a bad chest cold, or a pneumonia or flu or anything else like that, your reserve, that means your ability of your lung to handle any more stress, is very limited. And if more happens, then you may not be able to breathe at all. And if you can't breathe at all and talk at all, then the sequence of events would be...
You should have been around here yesterday. Well, we had all the angels down there, and all of them, I had to close them up, and we had to go through all the equipment, and it was quite a wrestle.
So if the breathing gets worse, they could be talking about putting a tube in your throat and hooking you up to a respirator.
Yeah.
And unfortunately, if something like that happens with everything else, then it may be very difficult to get you off the respirator. And I think the first thing that you guys as a family need and you need to think about is, here you are, you've had something happen to you, you're now you're sick, that's why you're in the CCU, but you're reasonably stable right now, but still sick. But if something was to worsen on top of everything else right now, would you really want to be put on a ventilator, on a breathing machine and life support, with the possibility that, coming off of it could be very difficult, because, your body is functioning maximally to just keep you like this.
No. Dad.
Right, hell, I'm twiddling.
Anyway, Dad, he was right at the ventilating system. What you wanted to be done on that?
On the ventilation
Yeah.
system.
I was saying, if things got worse, would you want to be put on life support with machines and tubes down your throat?
Oh. I don't think I would go too far with it.
And I think... I think that that's the right thing, because if you end up on a breathing machine, you may not be able to come off.
Yeah.
And the question that I always have in my mind is, there are two different things: quantity of life versus quality of life.
Yeah.
And oftentimes people worry a lot about how long will I live, but at what cost.
I've gone through that in my mind all along. And following my wife's footsteps, pretty much like she is.
Come on in. Does everybody know Dr. Malik?
Oh, yeah.
We met some of the family members.
Yep.
I'm sorry I had a procedure this morning, so I just finished, and I talked briefly to Dr. Hassan. I appreciate him being here and helping out, facilitate the discussion.
So I think Mr. Neff has kind of indicated that he would not want to be on a ventilator or life support. And the other thing that you brought up is that he wants to go home, right?
Yes.
And to me, when you have someone who's got as many issues as you have right now, the hospice folks are the perfect folks to be able to help you at home. Because when hospice gets involved with a family, when we try and find oxygen and other breathing stuff, when we try and get that approved as doctors to the government, it's you have to go through a bunch of hoops. Yeah. When a decision is made to get hospice involved, it's much easier. And what hospice can do is they can provide, you know, medications, oxygen, and other various support, plus additional medicines that help with what you said, gasping. You know, medications can be given to make it so that patients don't have that subjective sensation of, I can't catch my breath, I can't catch my breath, which is a horrible sensation for any patient. So I do think that, you know, since you have said that Mr. Neff would want to go home, which is his desire, if he goes home with all the things that are going on with him and with the amount of oxygen and other things that he would need, a hospice agency would be the appropriate people to follow him and help with getting him the equipment, oxygen, and medications that he might need to make his time at home as peaceful as possible.
Will we be able to get him home and transport him comfortably?
I think so. Do you see any reason why?
Well, you know, I think his oxygen requirements are very high,
Right.
and there's only a certain amount of oxygen that you can provide in the home setting.
Right.
You can't have all these tools and
Right.
gadgets that we have in the hospital setting. And I think his oxygen requirements will continue to remain high for the foreseeable future, in my opinion. So it's possible and it's very likely that his oxygen level will be borderline.
Right.
And that you can supply a certain amount of oxygen at home,
Right.
but it's not going to be as sophisticated and as
Right.
closely monitored as we're doing in the hospital. So yes,
We know what to expect once we're home. We're just wondering if you'll be able to transport and get home.
well we
Comfortably.
can what so you have what do you have available? Non-rebreather mask basically, and
A
what's the
non-rebreather and at best 20 liters.
20
That
liters?
is-
Okay.
yeah.
Is that from the high flow cannula or okay? What kind of concentrator do you provide with the home? Just a regular
Just a
concentrator?
regular concentrator.
Okay.
Yes.
Is there, so that usually only generates 6 liters of oxygen, 5 to 6 liters of oxygen
Yeah.
in non-rebreather mass.
Yes.
So what we can do, and I'm gonna ask my nursing colleague to help me and see if we can transition him to that and see how he does. I mean, we can do the test here, right here, and see how he oxygenates with that same level of oxygen that is provided at home, and see how he copes with that.
And it'd be a mask that we'd place him on to go home, as a non-rebreather mask.